Bonjour à tous et merci beaucoup pour m'inviter. Le problème, c'est que mon français, c'est pas très bon et pour ça, je vais faire de la présentation en anglais. Mais merci beaucoup pour les gens qui font un travail dans l'innovation des santé. Et surtout les gens qui font le travail dans le territoire de santé de demain, dans le métropole. Now I change to English, and I have the help of Julia, so it will be easy for you to understand. A short introduction. Pierre already told you that I'm a pharmacist. I've been working since 40 years now in santé publique and exercising a lot of activities in healthcare, for instance with the International Organization for Integrated Care, where all these activities that Antoine mentioned here are as well in long years of activity. And in Germany, we had the possibility with a law that came into effect in 2000 to introduce integrated care in Germany. And I had been in these times working with the University Hospital of Hamburg, and then we developed a company, and that is a think tank for the management, the research, and the analysis and the data analytics of integrated care. And so Optimatis is now an organization that's around 40 people working for it from all different sides of applications in healthcare. And we are concentrating on research on one side, on analytics of data, routine data of sickness fund, and as well working in the areas, in different areas of work. And the problems that arise in Germany are the same problem like in France. So we have a fragmented healthcare system. We have the problems of inequality in healthcare. We have the problems that the quality of care is diminished by the sectorization of healthcare. We have the problems that we don't have enough workforce now for the future. And that's a big problem, especially in the smaller areas of Germany and the rural area, but as well in the areas of the cities where the more vulnerable people live, because it's not that exciting and not that rewarding the doctors working there instead of working in the richer areas. So there's an analysis of data in Germany that came to the situation that more than 75% of the population aged more than 70 years has already more than 3 or more morbidities at the same time. So the problem will arise even stronger when the demographics grow and the people get older and less younger people come into the healthcare arena. So we have to work on the situation of mobility. So the question calls for prevention and the call for a good help for the people to self-manage their own health will be absolutely necessary. And so there are a lot of activities now in discussing how to change problems for the future. And you may know that there's a big healthcare reform for the big hospitals in Germany at the moment, running is not finished, but it's in the way of running. And there are a lot of other activities on the legislative sector to reform the healthcare situation. And we think that that the regional context will be of absolute necessity. That will be the essence of the change, because only in the regions you know each other, you know who is working, whom we should try to engage into our work, how to engage the associations and the communes and all these people working there, and maybe even the enterprises, the factories, so for the healthcare of the workers there. So that is the absolute focus of our work, the regions. And you see now that the presentation of Antoine on the responsibility populationnelle, it's really just the same like our work, but our ideas. Maybe the regions differ a little bit. In my opinion, the regions should not be too big. So La Région Grand Est would be too big to change, but maybe there are areas inside this region that can be changed, where we can try to effect real change. And maybe the CPTS or the Maison de Santé some better favorable for this activity, to integrate the hospitals into this activity as well. But you see, in the center of our graphics, we try to set there's some kind of organization you need for changing, for doing the administration of the change, for organizing all these activities, for motivating the people for all these things. And that we call it's an integrator. It's the discussion came from the US with the quadruple aim, that there is a need for some kind of organization looking forward to integrate the services and to bring them together. That is not meaning that this integrator has to own the service. It means that the organizer, the organization, has to organize this kind of work, but it's not meaning that it has to own. So there are the idea is that all these organizations are liberal in their own activities, but they get connected to each other, and this connection is some kind of work. And one of the most important things is to integrate the patients themselves as well. I see that Antoine already mentioned the patient organizations, but that is really one of the principles of success. If you really are able to engage, motivate, and bring the patients and the people living inside these regions together with the providers and the actors in healthcare. So in our programs in the different regions, we developed a lot of specific programs to integrate patients and actors in healthcare. So always looking forward for different diseases, for instance, here for pelvic problems, or for problems with the high blood pressure, or with the problem with pulmonary diseases, COPD. And you see there's just every other year or every other quarter we develop new programs for the pathways for the patients there in the future. To engage the actors in healthcare, that are the infirmiers, the paramedics, the doctors, the pharmacians. So we use different methodologies to integrate and to incentive these people to work with us together. And there's things like that we pay for certain time that we use from them, or we use digital tools to support them, or we develop the programs together with people from the sites. and every kind of work has to have quite a lot of communication and activity around it. The nearest activity to Strasbourg is in Kinzigtal. You may know it's just on the other side of the Rhine. And that is now an activity that started already in 2005. So it's on long terms that we are working with. And new work has been done in Hamburg, in some poor parts of Hamburg, where we developed a health kiosk model. And now in other regions as well, just in the center of Germany. So, and not only in Germany, but as well in other parts in Europe. But always it's a long work, it's a long road to come to develop these projects. It's not easy because it's always a little bit different to the normal way of working in these fragmented, sectorized systems. One of the important parts of the work is to come to work with the data, with the routine data of the signal. That is one of the prerequisites for a good immune situation, so that we can analyze the data, that we can evaluate what are we doing and to which kind of effects do we come, and what is how to concentrate, which parts of the population we have to concentrate, so to reduce morbidity and the aggravation of morbidity. Yesterday I had the lucky situation to meet Jan in Paris, and we discussed about the effects of our work. And you can see here, it's the OECD, the OCDE, I think in French, that developed a study on our work. And they came to the conclusion that with the way of our work, for France, about 3.5% of the total costs of care could be reduced over the years. So, and they analyzed our effects that we had in Kinzigtal and the other regions. So there is a possibility to really prove that it is possible to do this kind of change and to really get to successes for the whole society. And this graphic here shows a part of a preventive case care pathway. This care pathway has to be further specified for diabetes. So it's the identification by carers, the referral to an IPA nurse, then to configure the network and mirror that network into the Partie tool that has been developed in Context. Confirmation with the multi-professional team afterwards, then taking the IPA for case and care management for these patients, and then maybe to use to motivate the patients to go into physical activities or medical-social care or psychosocial care or even self-engagement. That activity will be accompanied by a data sharing pool, so the Partie tool from Partie will develop or will allow to share the information between the IPA and the providers and with the team. And we want to extend this further towards the patients themselves and to link that with the digital tools of the patients that they use themselves by, for instance, Mornis Pass. And that the effects we saw in Germany can be seen in France as well. This short introductory and explanatory study that we did with the activities of Sport Santé in Strasbourg. And you see that even here with a small number of patients being part of this, with the CPAM evaluation, we saw that the total cost of care got down for those who participated in the physical activities. Thank you very much for your attention, and you will have all the possibility to get the slides. So I think the image will distribute the slides as well, so you may see it and we might go to contact afterwards. Thank you very much.